I think I'm going to go ahead and get us started. It seems like we have a really good group here today. So thank you all for coming. My name is Marissa. I am with the New Lenox Fire Protection District. And I also have other members you'll see from our committee. You can go ahead and introduce yourself.
I'm Detective Duffy from the Manhattan Police Department.
And then Officer Simon is wandering around here. He'll be back in the room here in just a minute. He may be going to grab us more coffee. But again, we want to thank you all for coming out in the middle of your day. We feel like this is a very important topic. And so once a year, we always want to bring our speaker out. And this is Loretto Cowhig with Northeastern Area Agency on Aging. And she is our guru today on everything that has to do with Medicare. So with that, I'll let you
Thank you.
start.
I'm very glad to be here because Medicare is an important topic, and especially so at this time of year. We just started the open enrollment period, and probably most of you have some decisions to make. And we in the Medicare field always say we would much rather help people before they make a decision, before the deadline comes, so that they understand what their options are and make a good choice, rather than try to clean up the problem after the fact when you've chosen less than ideally or missed the deadline. My guess is that the single thing you most want to know is what is the Social Security cost of living adjustment going to be for next year, and how much is the Part B premium going up. The Social Security COLA will be 1.6%. For most people, that will be in the range of about $12 to $25 a month, depending on however much your benefit is now. That's for a single person, 1.6. The Social Security trustees several months ago predicted it would be about 1.8%, so it didn't quite reach that level. The increase is based on the increase in the cost of a standard market basket of goods and services that is supposed to be representative of how Americans spend their money. Of course, no two of us spend our money exactly the same way, but on average, that's what it comes down to. So they measure it in the third quarter of every year, which is July, August, and September. And then they compared that cost of the market basket in the third quarter of last year to the cost in the third quarter that just ended 3 weeks ago. And that's what produced the increase of 1.6%. From time to time, there are proposals to have a separate cost of living index for seniors, because seniors spend their money differently. Healthcare costs rise more rapidly on average than the overall cost of living, and seniors spend a higher proportion of their income on healthcare. So that means that we're frequently at a disadvantage when it's a national average. On the other hand, seniors are spending very little on college tuition, and that's another figure that's bumping up the cost of living overall. So I don't know whether Congress will ever do it, but that is a proposal that does get introduced from time to time. For the immediate future, it's going to be 1.6%. The Part B premium is the amount that in most cases is withheld from your Social Security benefit, and Social Security just pays it directly to Medicare. This year, it's $135.50 a month. Next year, it's going to be $144.30. So that's an increase of about 6.5%, considerably more than the COLA. In some years, if the COLA is very low and the increase is high, the increase in Social Security is not enough to cover your Part B premium increase. And so when that happens, whatever exceeds your Social Security COLA is just waived. It's forgiven. It's called the hold harmless provision. Nobody's net Social Security after the Part B premium is withheld can go down because of an increase in the Part B premium. But that is not likely to be a factor for anybody this year. If your COLA is, say, $14 and the Part B premium went up by $8.30, you'll still have a whopping $6 or so to play with. That'll be your increase. This time last year, if you were in this audience, you may remember that I talked about new Medicare cards with a number other than your Social Security number. It used to be that it was your own Social Security number or your spouse's with a letter code at the end. Way back when when Medicare started in 1965, that system seemed like a wonderful idea because identity theft hadn't been invented in 1965. It wasn't a problem on any scale. But in recent years, Congress has been increasingly aware that identity theft is a very big problem. And if you have your Social Security number on your Medicare card, and also the date on which your Medicare began, someone who steals or finds that card has a head start on figuring out your identity. So that's why they made the change. And now we have this 11-character number that doesn't stand for anything. None of the characters in that new identifier represent anything. It's no hidden code. That means if you lose it, or if it's stolen or your identity is stolen, Medicare can issue a new number and they keep track of it. Whereas if your old card with the Social Security number on it was stolen, you were in trouble. You knew you were vulnerable. So if you have your new card by now, you've probably brought it to doctor's appointments and they've made a copy of it and they can bill Medicare correctly. The old card with the old number is good until the end of this year. But after January 1st of 2020, it cannot be used anymore. So you might as well shred it. Don't throw it in the trash, shred it so that nobody can find it and be up to mischief with it. The ultimate purpose of the new system is to make us all safer. But in the short term, we're vulnerable because people are still making the adjustment to the new card. And con artists all over the country saw this as another opportunity to worm people's numbers out of them. So if you get a phone call from some pleasant person who says they're with Medicare or Social Security, and they just want to verify that you got your new card, and would you please read the number to them? Hang up. Medicare and Social Security do not have time to call 55 million people to verify that you got your card. And they know what the number is because they issued it to you. That call is a scam. Don't worry about being polite, just hang up. And then go shred that old card. Another issue that comes up frequently is people got half the story but not the whole story, and that is about Medicare supplemental policies. The half that they got, or they think they got, is that policies C and F are going away. That's not true. Medicare supplemental policies are labeled A, B, C, and so on. And that causes confusion because people get it mixed up with Medicare Part A and Medicare Part B. But C and F are the most generous of the policies. Also, not surprisingly, the most expensive. After the 1st of January of next year, just over 2 months from now, new enrollees in Medicare will not be able to buy C or F. But if you already have it, you can keep it for the rest of your life, provided you pay the premiums. They cannot cancel it, they cannot take it away from you. Neither Medicare nor the insurance company can do that, as long as you keep paying the premiums. Furthermore, somebody who's already on Medicare will still have the option to buy those C or F if they want to. The only people who will not have access to it are newcomers, new enrollees in Medicare after the 1st of next year will not be able to buy C or F. What's the point of this whole exercise? In your Medicare and U book, which I hope you all have and safely tucked away in your desk drawer for a ready reference, there's a table on page 70 that shows what each of those standardized policies costs. When I say standardized policies, what I mean is that an A policy is the same as every other A, no matter what company you buy it from. An A from Aetna is the same as an A from Blue Cross. It's the same as an A from Humana. It's the same as an A from United Healthcare and every other company. They're all exactly the same. Every B is exactly the same as every other company's B, and so on. But the prices are not. Each company that sells Medigap insurance is free to set whatever price they want, knowing they are in competition with one another. But in this chart on page 70, it shows you what each one of these policies covers. And if you take a look at it, you will see that A covers the least and costs the least. F covers the most and costs the most. C and F are the only two policies that cover your Part B deductible, which this year is $185. And that's what Congress decided they wanted to eliminate for future enrollees. The theory is that if I know that I have an F policy and that will cover all of my out-of-pocket costs for Part A and Part B, I have no financial incentive to conserve health care. I may go to the doctor every time I get a hangnail because it's not going to cost me anything. Medicare and my supplemental insurance between them will pay everything. And that's not a wise use of tax dollars or insurance dollars or the doctor's time. It's wasteful. So they wanted to give everybody at least a little incentive, financial incentive, to conserve. And so they did that by saying, starting next year, newcomers will not be able to buy those two policies, C and F, that cover the Part B deductible. So they know they're going to have to pay at least that much before Medicare starts paying for Part B services. So that's the reason for the change. But if you can't buy a C or an F, it's really not a big loss because G is exactly the same as F, except that it doesn't cover the Part B deductible, and D is exactly the same as C, except that it doesn't cover the Part B deductible. But logically and unsurprisingly, D and G are less expensive. So you either pay it as a deductible to Medicare or you pay it in your premium to the insurance company. Either way, it's not a big deal. But I will venture a guess that almost all of us in this room who want a Medigap policy already have it. And if you have a C or an F, you can keep it the rest of your life. Don't worry about it. If somebody tells you that C and F are going away, you can correct the story because that's not true. And that's the only change I'm aware of with Medigap insurance. I hope everybody got the two handouts that I gave you on legal size paper horizontally. And the first one is a list of all of the Medicare drug plans, the Part D plans for next year. And these are the plans that are offered everywhere in Illinois. No matter where you live in the state, these are the plans you have to choose from. My husband, who is a very good egg, helped me proofread this table and the next 2 pages too. So if there are any mistakes, you know where to go. We'll blame them on him. He's not here to defend himself. And you'll see there are all these different companies and all these different policies. And it lists what the premium will be, what the deductible will be, and some information about what co-payments will be if you use a preferred pharmacy. Medigap urges people to do what's called a plan finder every year. The plan finder is a tool on the Medicare website in which you enter a list of all of your drugs, and it will then tell you, for this list of drugs for someone in Illinois, here is the plan that will cover those drugs at the lowest total cost. And then it tells you how it arrived at that figure. The premium is so much times 12, and this counts towards the deductible, and this is what the co-payment for each drug would be. And so you've got a very objective source of information. The Plan Finder doesn't steer you to any particular insurance company or any plan. It just does it on the basis of total cost. Medicare believes that up to 90% of all Part D enrollees are paying more than they have to, because they don't do the Plan Finder every year. Now, in many cases, The amount that they're paying unnecessarily is very small, $5 or $10 a year. So if you did a plan finder and discovered, I can save $10 by switching from this year's plan to something different next year, maybe you think, for $10 it's not worth it. Things are going well, that's less than $1 a month, I'll just stick with my current plan. That's fine, it's your call. But sometimes you do the plan finder and you discover, I could save $300 by switching. Well, I can think of a lot of things I'd rather do with $300 than spend it at the pharmacy counter. So I would switch. But if $300 is not a big incentive to you, stay where you are. It doesn't matter. But if you do the plan finder, then you will know. If it turns out that you're already in your least expensive plan and you want to stay there for next year, you don't have to do anything. You will automatically be re-enrolled. But if you want to switch, this is your opportunity. The enrollment period began the 15th of October, last week, and runs until December 7th. So you can make a change anytime during that period, and it will take effect the 1st of January. The Plan Finder has had one change that I'm not crazy about. It used to be that you could save your list of drugs and then amend it if necessary. If you forgot something and you wanted to go back, or the doctor changed your dosage, you could make that change. Now you can only do that if you have what's called a My Medicare account. This is an account which you have the option of establishing on the Medicare website, and it will link you to your medical records through Medicare. Doesn't tell you what your test results were, but it tells you you had such and such a test on such and such a day and you paid so much for it. And it has a list of all the prescriptions that you took. So if you have that account, or if you choose to set one up, it will automatically give you access to the list of all the drugs you took last year, and you can go through it and delete something that's not in use anymore, or update the dosage, or make any other change, and it will save that list. If you don't have a My Medicare account and you don't choose to set up one, that's okay. You could still do the Plan Finder anonymously, but it won't save your drug list. Which means if next week you remember, oh, I forgot to put in that new prescription, you have to enter the whole list over again. It's not a big deal, but it is a time-consuming and kind of a dull task. So I urge you to do a Plan Finder. If you have trouble with it, get your grandchildren. They will be happy to help you with it. And there's professional help available. SHIP is the senior health insurance program that's offered all over Illinois and throughout most of the country. We're trained by Medicare and by the State Department of Aging and the Department of Insurance. And there are SHIP sites all over the state. Here in Will County, there's one at the Senior Services Center of Will County on Center Street in Joliet, and they have a number of SHIP counselors. Call them and make an appointment. They will be glad to help. Please don't wait until December 6th, the day before the deadline, because by then they are fully booked and they are exhausted, and you're really taking a chance that they may not get to you. Just call and make an appointment. Have a list of your drugs up to date. We would need the name of the drug, the dosage, and the frequency, such as I take Lipitor 10 milligrams once a day. I take levothyroxine 75 micrograms once a day, whatever. Have that list handy, and they will be glad to do a Plan Finder for you. And if you would like, they will establish a My Medicare account for you, and that will simplify it in the future. Page 2, yes?
I know the video's running, but you can also call me at the township, I can help you through with it, okay?
Oh, very good, even
Yeah,
closer.
You can come down in my office and we'll figure it out.
Thank you. Page 2 and 3 of your handout is a list of all the Medicare Advantage plans that are offered in Will County. Medicare Advantage is the managed care option that Medicare offers you. This includes health maintenance organizations, HMOs, preferred provider organizations, PPOs, and a few other variations such as a private fee-for-service plan, and new this year, medical savings account. If you are in a Medicare Advantage plan, you are still on Medicare. You still pay the same Part B premium whether you're in Medicare Advantage or traditional Medicare, the same $135.50 a month this year. Medicare Advantage plans must offer all the standard benefits of traditional Medicare. They can't skimp. And they frequently offer extra goodies. The extra benefits that are most common are some dental care, some vision care, hearing care, or membership in a fitness program, a wellness program, a gym, something like that. That would encourage you to get good exercise. Frequently people call and say, I want one of those plans that I saw the ad on TV that covers dental care. Well, that could have been any one of dozens of plans. In the ads, of course, it's the nature of all advertising to make whatever the product is sound wonderful. Frequently, it's not quite as good as they make it sound in the ad. Maybe they do offer comprehensive dental care. Maybe it's only 2 cleanings a year. Maybe it's an average or a limit of, say, $500 a year in benefits. Whatever the terms are, maybe you have to use a particular dental clinic, not the dentist you've been seeing all along. So I'm not depreciating that benefit. It's any dental care is better than none, but it may or may not be what you want. So before you join such a plan, ask a lot of questions and get it in writing. If the salesperson or enrollment clerk tells you something, but they're not willing to put it in writing, then it may not be reliable and you won't have anything to stand on when you want to make a claim at some time in the future. So just ask a lot of questions. An HMO, a health maintenance organization, has a network of providers. Certain doctors are in the network, certain hospitals, other providers such as a physical therapist are in that plan's network. In an emergency, you can go to any hospital. If you're in an automobile accident anywhere, they'll take you to the closest hospital and your HMO will cover that care. But for non-emergency care, if you're in an HMO, you have to go to a doctor or a hospital in that plan's network. If you go to somebody else, the plan will not cover it. You will be responsible for the entire cost. A PPO, a preferred provider organization, is a little more flexible. As the name implies, it has a list of certain providers who are preferred. If you go to one of the doctors or one of the hospitals on that preferred list, the plan will pay the highest proportion of the cost. But if you go to a non-preferred provider, they will still pay something, unlike an HMO that won't pay anything if you go outside of the network. In an HMO, you almost always need a referral from your primary care physician before it will cover care by a specialist. So if you want to see the cardiologist, the oncologist, whatever other specialty, that's only when you are referred by your primary care physician. PPOs are generally a little more flexible. They don't require that. HMOs may also require prior authorization before you have some kind of procedure or surgery, which traditional Medicare doesn't. So it has the potential to save you a lot of money, but it does mean you have to play by their rules. One of the big reasons that an HMO or a PPO can save you money is that you do not need, and by law you cannot have, a Medicare supplemental policy. You'll see in this table, the third column from the left is out-of-pocket limits. And the very first one, which is an Aetna HMO, just in alphabetical order, their out-of-pocket limit is $3,450. That means that no matter what happens, no matter how many surgeries you have, how many times you're hospitalized, whatever, the most you're going to pay for Part A and Part B services provided by an in-network provider is $3,450. Well, that may be more than you have in your pocket right now, but it's nothing compared with what you might have paid if you were in traditional Medicare and you might be billed 20% of all the costs under Part B. So you don't need a supplemental policy, and so you're not paying that premium every month if you are in a Medicare Advantage, HMO, or PPO. Frequently, if you have all these plans to choose from, I think it's 38 different plans here in Will County, how do you know which one would be your best choice? How do you wade through all of these details? Frequently, the decisive factor is, I go to Dr. Smith, I want to continue to go to Dr. Smith, which plans is he in? It may be that the easiest thing is to call Dr. Smith's office and say, which Medicare Advantage plans do you accept? Are you in the network for any of the HMOs? Are you preferred for any of the PPOs? That may enable you to whittle it down a bit. But if you see Dr. Smith as your primary care physician and also Dr. Jones for a specialty and Dr. Murphy for another specialty, now it may get harder to find one plan that has all three of those doctors in it. So you have to be prepared to do a little footwork to get all that information. Or as the old ad said, let your fingers do the walking and make some phone calls and find out which of these plans would be a good choice for you. On the very last page, down at the bottom, you'll see medical savings account. That was a new form of Medicare Advantage offered this year for the first time. I have yet to meet anybody who was enrolled in this plan. As it says, the deposit is $3,240. An account is set up in your name and the plan deposits that amount, $3,240, in that account. And that's what you can draw on to pay for medical expenses. But then you see in the other column, the annual deductible is $7,400. So once you've used the $3,240, if you have further expenses up to $7,400, you pay 100% of that. So this is for people who are in good health and who have a streak of gambler in them, which doesn't describe me. But if it appeals to you, please let me know how you like it, because as I said, I have not encountered anybody who has done it. As I mentioned, all of these Medicare Advantage plans are offered anywhere in Will County. You can only join the plans that are offered where you live. For instance, I live in Kankakee County. Even if the doctor and the hospitals that I used were all in Will, I could not join one of these plans unless it was also offered in Kankakee County. Medicare Advantage plans contract with Medicare to serve a specific geographic area and the people who live there. So that's why you have this list specifically for Will County, and these are the only plans you have to choose from. But out of 38 plans, if this concept appeals to you, there should be one that is a good choice for you. Let's see. You know, under the Affordable Care Act, Medicare greatly expanded the list of what are called prevention and wellness benefits. At this time of year, you're seeing ads for flu shot clinics at all kinds of places like the health department, the senior center. Many pharmacies offer them, and Medicare covers that cost in full. There's no cost to you at all. You just show them your Medicare card. It's not subject to a copayment, and it's not subject to the Part B deductible. So even if you haven't met your deductible yet, that flu shot is free. Same thing with a pneumonia shot. And there are many other prevention and wellness benefits, and they're all listed in your Medicare and You book in the section on Part B, and they're marked with an apple, on the theory of an apple a day keeps the doctor away. Occasionally somebody will say, the flu shot is free and the pneumonia shot is free. Why isn't the shingles shot free? The shingles vaccine is covered by Part D. So if you haven't had that yet and you still want to, when you do the plan finder for next year, include that in the list of drugs that you will want. Because if you leave it out, that will distort the total drug cost that you will pay. Not everybody should get the shingles vaccine, not everybody should get the flu vaccine, and I am not qualified to give you advice except to say consult your doctor. And I did read recently that the Center for Disease Control says if you're going to get a flu shot this year, do it sooner rather than later. You don't want to get it too soon because then your immunity might dwindle out and the flu shot or the flu season continues on into the late winter and you might be vulnerable. You don't want to get it too late because then you're vulnerable until you've had it and it takes a couple of weeks for the full immunity to build up. But they're now saying they anticipate that the flu season will start early. So get your flu shot now and reduce the chances. It's not an absolute guarantee, but you will reduce your chances. Then I want to mention something that is not related to Medicare at all. But whenever I tell people about this, they say, I never heard of this. And that is the new Real ID. Under federal law, to make us all safer when we fly, when we use a variety of federal facilities, we will have to have an upgraded driver's license or other identification card. And in order to get it, you have to document that the person named on your birth certificate is the same person that you are now and has such and such a social security number and lives at this address and so on. For men, it frequently is not much of a problem because they're still using the same name that they had on their birth certificate. For women, if you've changed your name, or you might have changed it for a reason other than marriage, maybe you were adopted, maybe you're Liz Taylor and you got married 8 times. You have to be able to document all of those changes. So I went through this recently and it took 3 trips to the DMV to satisfy them. They didn't like my marriage certificate. I had to get a certified copy of the marriage certificate, so that meant I had to write to Missouri and get it and bring that in, and then they didn't like my birth certificate. It was a long, complicated thing, whereas my husband was in and out in 1 trip. The absolute deadline is the 1st of October of next year. After that, if you don't have a real ID, you will not be able to get on an airplane. You will not be able to enter a U.S. military facility and secure federal offices, which I think include Social Security offices. You will have to have a real ID. So if you have to do it, don't wait until September when the office will be crowded with people who are all trying to beat the deadline. Get started now and then you can check it off. Yes?
A U.S. passport takes the place of that.
Yes, it does. A U.S. passport is also an acceptable identification. But most of us don't carry it around with us all the time, whereas we do have our driver's licenses. Was there another question?
Did you say a passport is okay instead of this?
Yes, it is. It is, because you had to provide all that documentation when you got the passport.
I see. And then if you have a real ID, is that also your driver's license?
Yes, it's just a regular driver's license and it has a gold star on it that indicates that you've provided the necessary documentation.
And can you go in any time and get one of these?
Mm-hmm. But you have to bring all this proof. On the Illinois Secretary of State's website, there is a checklist that tells you what you have to provide to prove that you are who you say you are. Kathy, yes?
As part of the Christmas present, for the Christmas party for TRIAD, I'm gonna bring a bunch of information about it.
Oh, very good.
And then hopefully we're gonna be able to get a speaker early on. I have a person in mind, so watch the paper and also make sure you keep current with our schedule. So,
Very good.
it's
Yes, sir.
What about if you don't have a driver's license, you just got one of these state ID?
You can get that upgraded too.
That's what I was wondering, if you can get that upgraded or if you have to.
Yes, you do. Because right now, if you wanted to get on an airplane, that's what you would show.
Yeah.
But after January 1st of next year, or excuse me, October 1st of next year, you have to have the upgraded real ID. So go to the Illinois Secretary of State's website and you will see a list of all the documentation that you need to provide. And you're going to have to do it, so you might as well do it sooner and don't wait for the rush. As I said, it took me 3 trips to the DMV before they were satisfied. Yes?
The only Secretary of State place that you can go to is the one in Joliet. You can't go to Orland.
Nope.
You can't go to Lockport, only the one in Joliet. There's one in Joliet, and I believe there's one in Naperville, but other than that,
Lockport does it.
no,
No, they just did it at Lockport.
they wouldn't let me do it there. Oh, they just started?
In July.
In theory, the process is the same no matter where you go, but we hear stories about friendlier personnel at some of the offices than at others. Yes?
Well, I thought of that with the birth certificates. Of course, my married name is different than when I was born. So what would you recommend me taking besides the,
Go to the Secretary of State's website and you'll get a complete list.
well, I know, but I'm saying, what should I bring with the birth certificate?
Well, the birth certificate shows what your name was at that time. If you're married once, bring that marriage certificate to show that maiden name, married name are the
Okay,
same person.
Marriage certificate.
Mhm.
And as I said, I'll be bringing information to the Christmas party.
Okay, so go to the Christmas party.
And if you miss that, just call me, I'll email it to you or you can tell me.
Okay.
I'm at the township.
Oh, yeah, I already went to the Secretary of State's office.
Yes.
Would the passport be enough to, get this?
Yes, that would.
We wouldn't have to bring anything else.
Right. The other thing I wanted to tell you today, and I touched on it, is about scams. You know, Medicare is such a huge program. There are billions and billions of dollars spent on the Medicare benefits, and therefore it's an irresistible target to con artists. They seize the potential for big-time illicit gains, and they're always coming up with new ways to try to steal money from honest people. 2 of the current scams that are most common are genetic testing. That's a new one. Have you had that phone call? Somebody says that Medicare will cover genetic testing to see whether you have a genetic predisposition to certain diseases, and they may send you the kit and you have to put some saliva in the kit and mail it off to Timbuktu. Many people never hear from them again. But Medicare is billed astronomical sums of money for this service. If your doctor wants you to have genetic testing, the doctor will say so and refer you specifically to a provider. The kind that you get in phone calls is not the kind of firm that you want to do business with. Another very common scam is from companies offering back braces and knee braces and neck braces. Their opening line is, do you have back pain? Well, who hasn't had back pain somewhere along the line? But again, if your doctor wants you to have it and thinks this would be helpful, the doctor will tell you so, will refer you to a reliable source of medical equipment, and they'll probably want to measure you to see exactly what size you are and what equipment you need. So don't succumb to those people who call you on the phone. Don't worry about being polite, just hang up. This morning I had a call about 8 o'clock. This male voice, well past puberty, says, "Hi, Grandma." Well, my oldest grandchild is 9 and doesn't call me Grandma, so I was pretty sure that was a scam, and I said, "Who is this?" And he said, it started some complicated thing about a broken nose. I just hung up. That was not my adorable 9-year-old grandchild. So many of you have had variations on that too. All kinds of scams that con artists come up with. If they would apply that ingenuity to legitimate purposes, they could just rule the world because they're ingenious at it. But don't fall for it. Just hang up. If it's something that your doctor wants, he will tell you. Ask the doctor if you're uncertain. If you get what appears to be a call from Social Security, the IRS, your police department, whoever, don't take their word for it. Call them back, the number that's in the phone book, not the number that the person who called you gave, because they can manipulate numbers and make it look like the call is from a legitimate source when it really is not. So we can't put those people completely out of business, but we certainly don't have to add to their ill-gotten gains. And don't worry about being polite, just hang up on all of those people. Those are the messages that I wanted to give you today, but is there anything else in relation to Medicare that's on your mind? Yes?
Sorry, I came in late in Perkins class. Did you discuss the donut hole?
No.
I missed it?
I'm glad you brought that up. The donut hole is the part of Part D, the drug benefit, that's been around since Part D began in 2006. In the initial legislation that created Part D, Congress wanted to be very generous to low-income people, so they gave them a subsidy, and they wanted to be generous to people with very, very high drug costs, so they got catastrophic level benefits. But they also had to stay within a certain budget, and something had to give. And the something was the middle of Part D, and that got the name the donut hole. And the donut hole in the beginning was the fact that when you reached a certain point, when the total cost of your drugs reached X dollars, the benefits stopped. That's why they called it the donut hole. There was nothing there. You still paid the premium, but you didn't get any benefit. So as you can imagine or remember, that was not a popular part of Part D. And under the Affordable Care Act, what's commonly called Obamacare, they included a provision to phase out the donut hole. So every year from 2010 until this year, the proportion of the cost that you pay has gone down. And next year, it will be completely gone. There will be no donut hole. You will pay 25% of the cost of your drugs on average, whether it's a name brand or a generic. This year, the donut hole only applies to generic drugs, which generally have a lower cost anyway. Last year was the last year of the donut hole for name brand drugs. So starting in the 1st of January, no more donut hole. The drugs aren't free, but 25% on average is what you will pay. Yes?
I have a question about this donut hole thing because I have a very expensive, it's called a PGP Plus Aetna, something like that, drug plan. And I always get into the donut hole because I have a very expensive drug. However, my doctor always gives me a tiering exception letter, sends them, and this year, and every single year, so that I can get through that donut hole till the end of the year, you know, and then take a, you know, breath and then start the next year. However, this year what happened to me, I got into the donut hole and they charged me a huge amount. My tiering exception went from a tier 4, I think it was, to a tier 1. So, because I really need this particular drug, I can't take any other one. And my hematologist knows this, and she explained. So, I was paying only $3 copay all year long, and suddenly it went up to about $400.
Ouch.
Yes, and so I complained about that because of the tier, because, you know, I said, well, what about my tiering exception? You don't pay this much for a tier 1 drug, you know, even if you're in the donut hole. And what they told me is this, that a tiering exception, which means money out of your pocket, does not apply. Those letters do not of exception, although it says from January 1st through December 31st, doesn't apply if you're in the donut hole. And I was really upset. I tried to get people to review this case and everything, because in previous years they never said that. So do you happen to know, do tiering exception letters actually not apply? So if you're in the donut hole, you can't get any tiering exception?
Well, you would have to read the fine print on the letter. I'm sure their legal department went over it carefully and they've given themselves a loophole.
I read every word of their letter. It says nothing about the
Okay.
donut hole.
Let me explain a little. Drugs are classified by tiers. In general, a tier 1 is a preferred generic. A tier 2 is a non-preferred generic. A tier 3 was originally intended to be a preferred name brand. A tier 4 is a non-preferred name brand. And a tier 5 is a specialty drug, which means expensive. And there are even plans that have 6 tiers, but that doesn't come up very often. But every plan gets to categorize their drugs. That classification, tier 1 through 2, 3, 4, 5, is the theoretical structure, but a plan can say, well, this is really a generic drug, but we're putting it as a tier 3 or a tier 4. So that means it's subject to a much higher copayment. When the doctor requests a tiering exception, don't charge this woman for a tier 5 drug, charge her for a tier 1 drug. That's a request. The plan doesn't have to grant it. They have to include the information, the correct information in the plan finder and tell you this is really a tier 5 drug. And when your doctor grants or your doctor requests the exception, they may grant it, but they don't have to. So that's another reason why you should do the plan finder every year. There's no guarantee that they will be that generous next year. I'm sorry if there's this uncertainty about whether the exception applies while you're in the donut hole, but do a plan finder so that you don't get caught next year. But keep in mind that you could be charged 25%. And 25% of $400 is still a hefty amount.
But she
No,
won't
no,
have
no.
to pay the $400.
No,
She'll just have to pay the 25%.
right.
The cost of the drug is like
Everything.
3,000 something a
Oh.
month. And I have to have it.
So then,
It was a tier 5 drug. When you described it, I realized.
okay, well then you could be charged 25% of $3,000, but within a month or two you would be into catastrophic.
Then you would, yeah.
And then you'd be out of the donut hole that doesn't really exist anymore, and you'd only pay 5%. Does that make sense to you?
Well, in previous years, it seems that I'm in the donut hole. They kind of calculate it so that they give me so that I have to be in it for a certain amount of time. I think I entered I'm not sure when I did enter it this time. It must have been in July.
We really can't do the arithmetic.
Yeah.
But do a plan finder.
It's the idea
Yeah.
of having the letter say from January 1st through December
31st.
31st, I have a tiering exception. It says that in
Uh-huh.
print in the letter, and yet now they're telling me, well, that letter doesn't apply to from July, for me, from July all the way to the end of the year, because you're in the
Now,
donut hole.
excuse me for a minute, I don't think Loretta's gonna be able to help you, but I would suggest that you make an appointment at Will County Senior Services, and they can work with you. They act as counselors,
Right.
and possibly you could get this straightened out. You could talk to the drug company, go online and see, talk to the drug company and see if you can work a deal out. I have a deal with two drug companies, my Januvia and my Trujea. So, you know, there are other ways that you can probably get help, and I would say going to a counselor at Senior Services would be the best way.
I
Okay.
would second that, and bring all your documentation so they've got all the information to
Well,
work
and
with.
when you call, ask them what they'll need too. That way you won't have to make a couple trips, okay?
Yes, sir.
The question is on your table, the first part of the table, will you have the star ratings? And I noticed they go from 3 to 3.5, and some have an NA. Is there some reason why some of those, like for instance, Mutual Omaha has an A rating?
That means NA not available. There is no rating provided because the plans are too new and they don't have enough of a track record for Medicare to have assessed them.
And do those ratings tie into what we just discussed about the tier 1 to?
No, these ratings are overall quality, and let's see. For instance, the first one, the Blue Cross plan, has a 3.5. That's on a scale of 1 to 5. And that is the overall rating based on 4, what you might call sub-ratings. And the 4 things that they rate are customer service, member complaints and changes in drug plan performance, member experience with the drug plan, and drug safety and accuracy of drug pricing. So from time to time, they survey people who are enrolled in these plans and get their opinions, and that's what they boil down to come up with those ratings. So the difference between a 3 and a 3.5 is probably not that much. The difference between a 3 and a 4.5 on a 1 to 5 scale could be significant. So that's worth taking a look at. Yes, ma'am?
You know, I've been reading someplace that Medicare is going to start paying $2,500 for hearing aids.
For hearing aids? Traditional Medicare does not cover hearing aids. It never has.
But it's supposed to be something new, right?
Some Medicare Advantage plans may offer hearing aids or a contribution towards the total cost. As I'm sure you all know, hearing aids can be very expensive. But traditional Medicare has not ever covered it. We hear all kinds of proposals of wonderful things that we would like Medicare to do. But since the Medicare system is already under some financial strain, I'm not anticipating a big expansion in benefits to include hearing or vision or dental.
There's not a new plan that covers that.
I'm sorry?
There's not a new plan or anything that covers that. New
Well, look at all those Medicare Advantage plans.
That's not Medicare. Medicare plan is just Medicare. Medicare, she's saying.
Traditional Medicare does not cover hearing aids. It never has. But some of these Medicare Advantage plans do.
Just like some of them cover dental.
So you're probably getting a lot of ads in the mail and seeing them in the newspaper and seeing them on TV. Make a note of who offers hearing aid services or benefits and give them a call. But of course, once you call them, they will then call you and inundate you with marketing.
I would call them the block number.
Yes?
Regarding physical therapy,
Mm-hmm.
is the maximum amount going to change in 2020?
Not that I'm aware of. A year or two ago, the question is about physical therapy and the amounts that Medicare will cover. It used to be that there were very tight restrictions on you could only have so many sessions, and they have lightened that up within the last 2 years or so, but I'm not aware of any further change for next year. Kathy?
Well, because I'm not on Medicare yet, but I do help some people. The Medicare.gov is amazing. And what's the most amazing about it is I had a question because I didn't understand and we called. It wasn't like that, but I did get the help. So please, don't be shy. Go to Medicare.gov and start reviewing it and get to know it. Plus, the Medicare and You book is on there, so you can, I don't think you want to print it off, it'd be a lot, but you can go through it.
Everybody should have a copy.
Oh, okay.
They mail it to you every fall, the new edition for the coming year.
Well, I didn't get that.
And it also cures insomnia. You can just read it and just go right to sleep. Yes, ma'am.
The SHIP program at St. Joe is not.
I'm sorry?
The SHIP program at St. Joe's is not accepting.
It's completely closed.
It is?
Yeah. St. Joseph's Hospital in Joliet used to have a wonderful SHIP
That's where I went last
counselor.
year.
And they just decided as a cost-cutting measure that they would have to eliminate it.
Oh.
I was
No
very
wonder
sorry.
You can't make an appointment.
Yeah. They don't. The woman who ran it still is at St. Joe's, but I think she's in the building department now. It was,
So they had to go to senior services.
right.
Okay.
There's also one in the east, a SHIP site in the eastern part of the county in Peatone, but that's not convenient for you. So I would call senior services in Joliet. Yes, ma'am.
These
PPO plans back here, is this where you could go to your any doctor?
In a PPO, they have a list of preferred providers. So Dr. Smith might be on the list of preferred, but even if he isn't, they will cover some part of the cost, not as much as if he were preferred.
Okay, so like if you were traveling or something and you needed medical attention,
If it were an emergency, they would cover it in full no matter where you are, just the same as if you went to a preferred doctor here at home.
okay.
But if you go to Florida for 6 months in the winter, then a Medicare Advantage plan that's based in northern Illinois is probably not a good choice for you.
Even though it would be a PPO?
Right.
Okay. And do they have to take you on these things? Because I know when I signed up for my supplement, I mean, I was on the phone for almost an hour with them. It could be through third degree.
For Medicare supplements, this is for traditional Medicare if you want a supplement. In the first 6 months that you are on Medicare, you have what's called guaranteed issue. They have to take you. No matter what company you choose, no matter what policy you choose, they have to take you. After that first 6 months, they don't. Then they can do what is called medical underwriting. And if they find out, oh, she's had 3 surgeries in the last 6 months and she's been in the hospital 5 times, they'll word it tactfully, but what it amounts to is, we don't think you're a good risk. They don't have to take you. So that's for a supplemental policy. For a drug plan or a Medicare Advantage plan, they have to take you. They can't refuse to. It used to be that if you had end-stage renal disease, kidney failure, which requires either dialysis or a kidney transplant, you couldn't join a Medicare Advantage plan. But if you were already in the plan and you developed kidney failure, then that you could remain. But starting next year, you can join even if you already have end-stage renal disease.
Well, I went through all this with trying to change my plan from an F plan to a G plan. It was a disaster. They finally did it. I did have to go through the underwriter. But, you know, if you're traveling anywhere, you have to be, like I have original Medicare, you have to have something that's acceptable anywhere.
Well, a supplement is.
Right, but I mean, like any of these, doesn't sound like it would.
Well, if you have Medicare Advantage and you just happen to be someplace else for a short time and that's when the emergency occurs, they'll cover you at the emergency room wherever. But if you're going for an extended period of time away from northern Illinois, then a Medicare Advantage plan may not be a good choice for you. But if you found a plan that's also offered in Florida or wherever it is you go, but be sure to ask a lot of questions before you sign on if that's your circumstance.
All right, thank you.
Yes, ma'am.
You keep saying emergency now. Say, for instance, this lady's in Florida for a month and she gets terrible abdominal pains or something like that. Well, that wouldn't really be considered an emergency. It's just a medical issue. Would they not cover it then?
If I were in terrible abdominal pain, I would consider that an
Well,
emergency.
maybe that was a bad example.
Yeah.
But anyway, she got maybe a bad cold or something. She had to see a doctor.
Yeah, and I
Not
wouldn't
really
say,
an emergency, but.
I wouldn't say a bad cold was an emergency.
No,
But I'm
so-
sure there's some medical leeway in defining what constitutes an emergency. But to me, a bad cold is not a life-threatening thing.
So they wouldn't cover it then?
Probably not.
Because I used to work for an insurance company and they had a definite criteria for emergency. A true emergency to get a higher benefit. And if not, then you got a lower benefit.
Yeah. Yes?
Go ahead.
Oh, you go.
My question is, I was just trying to understand on the prescription plan. So with Medicare, now I have I'm Blue Cross, and I'm looking at it and it says, okay, so the premium's gonna be $46.20. But then I'm looking at these other ones, and so they may be at least $20 less a month. But I need to look at the last column to see what I would be, the copay, is that
What you really need to do is a plan finder.
the plan?
The plan with the lowest premium is not necessarily your best bet. The plan with the lowest deductible may not be your best bet. The plan with the lowest co-payments may not be your best bet. Because one of those things that we mentioned earlier, the plans classify each drug that they cover. So what to you looks like a generic drug might be classified as a tier 3 or a tier 4 in a plan, and that means you're paying that higher copayment. The only objective overall analysis to determine the least expensive plan is the plan finder. You enter the list of your drugs and the dosage, and it will then tell you, for someone who lives in Illinois, this is the plan that will cover them at the lowest total cost.
And if you're not, the one thing is like, that can always change throughout the year, so you just sort of have to.
Definitely.
Well, it's true that we don't know what might be prescribed next June.
Yeah.
So you go with what you know now. Yeah. Yes?
Could you tell us anything at all about this company called WellCare? Because,
It's Aetna.
pardon?
It's Aetna.
WellCare bought out Aetna drug plans.
Okay, that explains it. So there is no more Aetna?
There are no more Aetna drug plans.
Thank you.
That's why they're not on this list.
Yeah, they didn't tell me anything, and suddenly I'm in WellCare, and I think it,
Well, if you don't do anything, if you don't initiate a change, you will, just as if Aetna had continued, you would automatically be rolled over into the same Aetna plan for next year. But WellCare bought out Aetna, so now if you don't do anything, you will be automatically rolled into one of the WellCare plans that are listed down at the bottom. But if that's not what you want, if you do a plan finder and figure out that some other plan from some other company is a better deal for you, you just call that plan or call Medicare or do it online, and you will be in that new plan effective the 1st of January. Incidentally, if you do that, you do not have to call the plan that you are leaving and say, I'm out of here. Medicare will do that for you. You cannot be enrolled in 2 plans simultaneously. So before you are officially enrolled in the new plan, Medicare disenrolls you from whatever plan you're in now, effective January 1st. So you just have to call or online enroll in the plan that you choose and know that your current plan will end December 31st. Yes?
My husband and I, neither one of us are on any medication. Is it worth getting into these plans if you're not on any medication?
Yes, it is, for 2 reasons.
Okay.
First, because the principle of all insurance is to protect you against the unpredictable. You don't know what you're going to come down with in February. You hope it's nothing, but it could be. The second is, if you don't join a plan early, when you qualify for Medicare or as soon as possible, and then you later decide you do want to join, you will have to pay a penalty called the late enrollment penalty. And the penalty is that for each month that you went without drug coverage, you pay an extra 1% on the base premium. And the base premium is about $35 a month. So 1% of that would be 35 cents. So if you went 2 years without drug coverage, you'd pay 24 months times 35 cents, which is more mental arithmetic than I can do. And you would pay that penalty forever.
Yeah.
The analogy that I use is my husband and I have owned a house for over 40 years and paid homeowners insurance all that time, and we have never had a claim. We have never had a fire, never been hit by a tornado, nobody ever slipped on the icy sidewalk and sued us. When it's time to pay the premium again, I don't think, gee, I wish we'd have a fire so we could collect on this insurance. No, I think, thank you, Lord, for another year of safety. And then we have the furnace inspected, and we put new batteries in the smoke detectors, and all those sensible precautions to reduce the chances of that emergency coming. But we know that the premium that we do pay is going to help somebody else whose house burned down. And if the situation were reversed, we would collect. That's the principle of insurance. And so that's why you want drug coverage. So I thank you all for your attention and your good questions. And I'll stick around if you have individual questions.
TRIAD works to improve the quality of life for seniors by providing an opportunity for the exchange of information between public safety, social services, and seniors. There are no membership papers to fill out or fees to pay. Everyone is welcome to attend. Each month, we present a guest speaker on subjects that keep you informed and up to date on the latest scams, frauds, and other criminal activities. We also discuss safety issues, home preparedness, and staying healthy. TRIAD meets the fourth Thursday of every month. Contact the New Lenox Police Department at 815-462-6100 for more information.